Most people aren't concerned about hair loss until it affects them or someone they know. But we care.
Hi, I'm Kayla Martell. If you're a woman with hair loss or thinning hair, like me, please listen carefully. Hair loss is a common problem for many women who don't know where to turn for viable solutions, until now. To learn more about the newest professional solutions for your hair loss, it will change your life.
Contact the professionals of Trinity Lace Wigs, changing lives one head at a time.
Morning, good afternoon, good evening, wherever you're viewing from. I'm Laura Thompson with TAN TV, the African American Network, where we have a local feel with a global reach, and you tune into the coffee break. And I just ran into a fabulous young lady. She is a double board certified physician, and we're going to talk about a little bit about what she does and how she does it. But before we get started with the interview, could you please give us a little information about who you are, what you do, why you do it, all that good stuff?
Of course. Well, my name is Dr. Adetoun Musa, and I am a double board certified neurologist. I specialize in both epilepsy and neurology, and me and my husband opened up the first direct specialty care practice here in San Antonio. So we are able to see patients quickly, sometimes within one day.
Wow.
And it is super important for those that are really just languishing and suffering from neurological disorders to be seen quickly so that their problem can be addressed and they can live their lives.
Wow. So you're a neurologist. So what made you go into that profession?
Well, honestly, I've always been interested in the brain and also just the complexities of thought and emotion. I remember when I was a kid, I would ask my mom questions like, well, what happens to the brain when you're sleeping? And I would ponder questions like, well, where does the emotion of love or excitement come from? What about fear? Where does that all like map out in the brain? And so I started looking all these things up on the internet. I would look things up in the encyclopedia, and that just really just stirred things up as far as my passion for neurology.
Wow. And your mom was probably wondering, where are you getting these thoughts from in your brain?
She'd give me some weird looks for sure.
Right. Wow. So that's awesome. So tell us, what is and what does a neurologist do?
That's a great question. So a neurologist specializes in neurological disorders. And what we do is diagnose disorders, and that is from just speaking to the patient with a physical exam, and then we might get the help from diagnostic resources like a scan, like a brain scan, an MRI, CAT scan, or an EEG. The types of disorders that we diagnose and treat would be in the central nervous system. So, for instance, seizures or epilepsy, migraines, any headache disorder, cognitive disorders like dementia, things like Alzheimer's disease, and even movement disorders like Parkinson's.
Wow. So neurology is a kind of specialty type of practice. And a lot of times if you just go to a primary care physician and you tell them you have headaches, they'll just say, oh, that's just normal, but it's not normal to hurt, is it?
Oh, no. Any pain is actually abnormal. It's a signal from your body that something is wrong that needs to be addressed. And so for headaches, it could be anything. If, for instance, you started having headaches when you're young, like maybe in your teen years, you have a family history of headaches, you get nauseous, you can't move, and you get light sensitivity, it may be a migraine. That's a type of headache disorder. And with migraine disorders, there are certain things naturally you can do, or you may need medications as well. If you all of a sudden start getting a headache later in life, like maybe your 50s, 60s, 70s, you've never had real headaches before, then that's when your body is signaling, hey, let's get this checked out. Maybe you need some kind of head scan.
Wow. I'm glad I never really had headaches. Knock on wood, I don't want to have them, but but so you're going to be speaking at an event on Saturday, November 15th, at the Moade Center from 10 to 2 for the Brain Health Summit. So tell us a little bit about what your involvement is with that, and,
Yeah.
and what you might be expressing to the
Yeah.
audience.
Yeah. So first of all, I'm super honored that I was invited to just share my heart about neurological disorders and how we can use alternative therapies to treat things like dementia and also things like mental health disorders. So I'll be talking about both. And this is not really going to focus too much on medications, although we can use medications to treat these disorders. But what I'm going to focus on is the capacity for your brain to heal and to make new neural connections. And yeah, for people who are having problems with memory, and maybe they've been diagnosed with Alzheimer's, for instance, there is hope out there to build these new neural connections and to bolster your memory. So I'll be talking about that.
Wow. So what age can they kind of re-energize their brains?
Yeah, that's a great question. So in high school, in college, in med school, just in my education, we learned about neuroplasticity. And neuroplasticity is the amazing ability of your brain to change and to adapt. It can change its structure, it can change its neural pathways, and it's all for learning. It's for adaptation and learning. And we were taught traditionally that only children, babies and children had real neuroplasticity, and that's why they're so quick at learning new skills. They can learn new languages. But we are finding now in modern medicine that even older adults can learn new things and build these neural pathways that weren't there before. And that is through something called neurofeedback, which is it's an emerging technology, but at the same time, it's been around for a while. And it uses an EEG band or headband to transmit frequencies or brain waves into a tablet in front of the patient.
Really?
Yes.
Wow.
And now a patient really can't interpret their brain waves. So what I do is I program a video game to give them positive feedback anytime they gain control over brain waves that are associated with poor memory. And then they can increase the prominence of brain waves that are associated with better memory.
Wow, it's amazing and this is administered through technology or?
It's all technology. It sounds like science fiction, but again, it's been around for quite some time.
Wow, it's science nonfiction. Huh?
Yeah. Yeah.
So you've been, you and your husband started a unique practice a couple of years ago. So tell us a little bit more about that.
Yeah, so the name of our practice is Kingdom Healing Institute, and we have been operational for a little bit over 2 years. I mentioned before that it's a direct specialty care practice, so we bypass insurance. There's no insurance involved. A lot of times with insurance, it can cause delays because of the referral system and pre-authorization. And so typically in the normal system within insurance, it takes about anywhere from 6 months to a year, over a year, to get in to see a neurologist. And these are for very severe problems. But what we have found is that if we can bypass that, we can see patients quickly, usually within a week, sometimes the same day. Some of the issues that I've seen patients have been life-threatening, and it's just a privilege and an honor to be able to see patients and get that issue addressed quickly.
Wow. So with your practice, you don't accept insurance, so is everything out of pocket?
It is out of pocket. Now, there are some insurance companies that have out-of-network privileges, and so we will work with our patients and fill out the necessary claims invoice for them to present to their insurance companies if need be.
Wow, so that's phenomenal, and to be able to get in to see you so quickly is a great benefit.
Oh, absolutely.
It's a life-changing and life-saving benefit.
Yeah, it's actually reminding me of one patient that we dealt with. This is right when we opened our practice. And we got a referral for a woman who was having headaches, right? So we were just talking about headaches. And she ended up getting a CT scan that was ordered by her nurse practitioner, and it was abnormal. And so the nurse practitioner sent her information and the scan results. I take a look at it, and it is a large tumor that is pressing on the back of her brain, which is the cerebellum. And just knowing what I know about the back of the brain, it's very valuable real estate. So she was having some issues with walking and coordination, but more importantly, it was increasing the pressure in her head. And over time, that can become dangerous, and it will increase the pressure so much that it pushes other structures of your brain out of the skull, and it may cause death.
Wow.
So this was a life or death situation, and we were able to see her the next day after I saw that fax. She otherwise would have been waiting for 6 to 7 months, and she did not have that time.
Wow, that's crazy.
Yeah.
Wow, that's crazy.
Yeah.
So that's just a testament of, how many issues people have, and I don't know if it's a shortage of neurologists to be able to see, a certain amount of people, but that's life threatening.
Yeah, a lot of neurological issues are life-threatening. There is a shortage of neurologists for sure in San Antonio, but I think also nationwide. And also the national average for just seeing a patient is only 7 minutes, which is really, it's just not enough time to collect all the information you need to get to the root cause of the problem.
Wow.
Yeah.
That is
Yeah.
crazy. Wow.
So that brain tumor patient, she had a headache. It was because of a brain tumor. I saw her quickly, and then we were able to get her to see a neurosurgeon the next week. They removed the tumor, and she's doing just wonderfully. She's doing well.
Wow. It's amazing.
Yeah.
What happens if you can find out what's really going on.
Yeah, absolutely.
Wow. That's awesome. So again, you're going to be speaking, and you can learn more about this phenomenal woman. She was a little girl when she was trying to figure things out.
Yeah.
Now she's got them figured out, and she's got a great successful practice and helping people all over the city. And she's going to be at the Brain Health Summit on Saturday, November 15th, at 10 to 2 p.m. at the Moade Center,
Yeah.
and that's at 302 East Ramsey.
Yeah.
And so she's going to be giving a 10-minute talk
Yes.
on, some of the things that you might look for, or tell us what you're going to be talking about.
Well, I'm going to be talking about what I commonly see on a day-to-day basis and how we use holistic medicine to treat patients. And so holistic medicine, a lot of people have different ideas of what that is, but it's really just looking at the patient as a whole and not just looking at their physiology or biologically what's wrong or the medications that they need, but maybe they have some psychosocial stressors, maybe at work, maybe they have some family issues that are contributing to the problem, or maybe there's a spiritual issue and they're just really angry at God, like why am I sick, And so we combine all of that together because that is what makes a person a person. And we give comprehensive care. We don't shy away from praying for our patients and holding their hand and walking with them. There's a lot of coaching involved in what we do. And then the alternative side is scientifically backed, and that is the neuroplasticity program. So building new neural connections encourages healing within the brain, and that can really help in addition to what we're doing to treat a wide array of neurological and psychiatric conditions, from dementia to depression or anxiety or panic attacks or PTSD or even traumatic brain injury.
Wow, that's phenomenal that we've got people like Dr. Musa out here that knows about these things, because that's seems like a very specific and specialty area.
Yeah, yeah.
So we're grateful that we have you out there working on patients and making sure that they get the proper treatment.
Oh, thank you so much. It's just it's an honor and a privilege, and obviously I'm very passionate about it. It is very interesting the way the human body works. And for me, specifically the brain and the nervous system. And going through medical school and as a training physician, I was not fully exposed to the potential of the body to regenerate itself and to heal. And it's something that definitely deserves not just exploration, but I think it should be disseminated throughout the country. Everyone should know that there's hope, even if you get a neurological diagnosis.
Wow. I know when I get sick, I rarely get sick, but
Yeah.
this last time that I was sick, and I haven't been sick in years and years, but I would just tell myself my body is strong and it can heal itself.
Yes.
And it can.
Yeah.
It can heal itself. And even through that pain, I would just keep telling myself that my body is strong and it can heal itself.
Wow. That's powerful. And you know what? That is another version of neurofeedback. You're giving yourself feedback. And so we do use that device for chronic pain, and we will focus the patient's attention on the frequencies in the top of the head. It's the sensory motor cortex that's responsible for pain modulation. And so then over time, they understand how to reduce the frequencies in that area. It reduces pain. But in between the sessions, we also tell patients to think positively, because that's another form of building those pathways. And so you already know that if you speak life over yourself, then the pain reduces, and your body responds in a way that it heals itself. And so that's what we do.
Yeah, I was trying to make myself believe that the pain was going to go away, and it eventually did. I woke up one day and it wasn't there anymore.
Awesome.
So I'm super excited
Yeah.
about that, because
Yeah.
nobody likes to be sick and in pain.
No one. Yeah. And we're here to address that. So.
Wow. So again, Dr. Musa is going to be at the Moade Center on Saturday,
Yes.
November 15th, and she's going to be giving us some more pointers about things to look for and how to treat them. And if you can't treat them, you can always come to her,
Yeah.
and she can help you.
Yes, absolutely. Yeah, I'm super excited to be at the Brain Health Symposium, and I think it's going to be a great opportunity to ask questions, any questions that are burning in you that you want to ask a doctor. I'll be here as well to receive those questions and just give you a different perspective on how you can better your brain health.
Wow. So do you incorporate nutrition into your practice?
Yeah, that's part of holistic care. So nutrition is very important. What I usually tell patients who either have a headache disorder like migraine, or there's something called cluster headaches, or seizures, is to try and stay away from as much sugar, refined sugar, as possible. And there have been many studies showing that specifically the ketogenic diet or modified Atkins diet can be used to treat both seizures and also headache disorders like cluster headaches or migraines. So I do incorporate that into my practice. Most of the time, we just are very simple because the keto diet is very drastic. So we test the waters first by removing the refined sugars. And a lot of patients get so much relief just by removing those processed foods and refined sugars. I see the same thing even with patients who have memory decline and dementia.
Wow. So you've been in private practice for 2 years, but how long have you been practicing neurology?
Yeah, I've been practicing for 16 years. 16 years. Time flies. I went to medical school at University of Virginia, and I started my medical school education in 2005. And then in 2009, I became a training doctor. That they call that residency. And I moved on to residency at Yale, and that's where I really learned to be a neurologist. And then I did some specialty training in New York, and that specialty training taught me how to read electroencephalograms, and that is the basis of our neuroplasticity program. and how we train people through neurofeedback to get better brain health and better memory, better mood regulation.
Wow. So it sounds like it's a very intriguing profession for you.
Yeah, very. It is. It keeps my interest. Maybe it keeps me young. I don't know. I'm always thinking about just the next new thing that's going to help my patients. I work with researchers as well. So I'm the principal and investigator for 2 studies connecting the health of your body with your brain health and your risk for developing dementia and also seizure disorders. And through the NIH, what I found is that, you were asking about diet and things like exercise and controlling your weight are very important because it reduces blood pressure. High blood pressure, high blood sugar from diabetes, that's associated with kidney disease and kidney failure. And kidney failure is directly correlated with developing these brain disorders like dementia and also epilepsy.
Wow. So all of that is connected. So
All of it.
If you get one of them, you're in trouble.
Yeah. But if you control it, then it's like even just controlling one aspect of your health, you benefit greatly and your whole body benefits. That is holistic medicine.
Wow. So just as a result of having the shingles, and I did research on what you should eat and all of that, and so I basically transformed my eating habits and my diet, and I've lost 13 pounds.
Congratulations.
Without even trying. Without
That's
even
amazing.
thinking about it.
Yeah, congratulate you. You must feel better, right?
I do, and I'm still I still need to lose some more, but
Yeah,
my clothes fit better. And the ones that I wanted to keep and didn't want to throw away because I said I'm going to lose this weight, I'm able to get into them, and so I'm super excited about that.
Well, that's a great testimony. I'm sure that you're going to reap the benefits, and you're not even aware of all of the benefits. But that's great that you lost that much weight. And shingles is interesting because it's from reactivation of a virus, the chickenpox virus. And sometimes if you're really stressed out or you're not sleeping, it reemerges, and then it looks like this. It feels like pain at first. Almost like a strip of pain, and then the rashes start developing, and it becomes very, very, very painful. It can be exquisitely painful, but with that type of inflammation, your diet is actually important, and the more sugar you eat, the more inflamed it gets.
Right. I haven't eaten any more sugar.
Yeah.
I'm like, bye-bye.
Yeah.
I want it.
Oh,
yeah.
That's good.
So
Awesome.
This has been a great conversation. I know I've learned a lot from you just sitting here, and how the brain plays an integral role in everything that you do in your whole body and the way it works. And she's going to be at the Moade Center November 15th from 10 to 2. She's going to give a 10 minutes speaking. She's going to be speaking for about 10 minutes to talk about some of the things that we discussed today, but you'll be able to see her up close and personal, be able to ask her questions about some of your concerns about your health and your brain health.
Yes, I can't wait. I think it's really a great opportunity to demystify the brain and not to be afraid of neurological issues or neurological questions or anything that might come up. So we'll be going through that.
Wow. So thank you so much for stopping by and sharing all this valuable information.
Thank you so much. Thank you for inviting me.
Oh, no problem.
Yeah.
I'll invite you again.
Oh.
So you've been tuned into The Coffee Break on TAN TV, the African American Network, where we have a local feel with a global reach, and we've been here with the phenomenal, fabulous, fantastic Dr. Musa. She is a double board certified neurologist and specializes in epilepsy as well. So we're so thankful that you stopped by.
Thank you.
Hello, family and friends. I'm Lakeisha D. Howard, and I am running as an independent candidate for the Texas House District 124. I am a servant leader in our community who believes in the voices being heard. I am a retired Air Force veteran, as well as a retiree from the Department of Veteran Affairs. For me, this is not about politics and party. This is about our community voice being heard. We can only do that as one. And that's why I have elected to run as an independent versus being tied to a particular party. I am tied to our community, each and every one of you. I want to show transparency and accountability. I want our voices to be heard at our state capitol. I want us to show love and action because that's what brings community together. So vote for me in November 2026 as your independent state representative for District 124. I'm Lakeisha Howard. I love each and every one of you, and I cannot wait to hear your voice.